¿qué quieres? Nunca he sentido nada igual. Esa boca quiero besar. Mami, mami, que say yes. La, 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 la. La, 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 la. Mami, mami. Mami, mami. Mami, mami. Mami, mami. Tus olas me sacuden como góndola. Te acercas y me enciendo como pólvora. El sueño te salir.
Get in here.
También debe ver que me vas a matar. Prometo ni una sola gota derramar. De aquí no me
It's waiting to go live on all these platforms.
Mami, mami, ¿quién eres? Mami, mami, ¿qué quieres? Nunca he sentido nada igual. Esa boca quiero besar. Mami, mami, que say yes.
Hey y'all, P. Happy Saturday. All right. Look like we at time. All right. Peace and abundance, y'all. Happy Saturday. It's your girl, Goddess Zee, coming through with a new segment on the network. Today is the Ask the Nurse segment. Now, let me tell y'all how this thing was birthed. I don't know what happened with the change of the season. Well, I kind of do. But a lot of people were needing assistance. And my husband loves his wife. And I was spending a lot of time explaining things to people about their diet, talking about their medications, explaining about like side effects they may have been experiencing. And he was like, girl, if you don't get these, compile these questions and answer them one time, you better. We need you. So this is an effort to kind of reduce like the amount of traffic that I have in my inbox, because I want to make sure that I address people's questions if they have questions about their health. I don't know everything, but I know a bit. And I can assist or outsource and, send you resources to help you out. So I am here so I won't get fined by my husband. No, I'm joking. This is the Ask the Nurse segment. You're probably wondering, like, who are you qualified? If you don't know me, now you know I am Goddess Zee. I am also a board certified nurse. But I do not practice traditional nursing anymore. I practiced bedside nursing about 15 years total, and I saw a lot. Learned a lot. It was an eye-opening experience. So I realized that there's not a whole lot of cures in Western medicine. It's a lot of pacifying remedies and ignoring the body when it's screaming at you. So when I started to battle my own health issues, I ended up curing myself from hypertension, gestational diabetes, thyroid issues, depression. And all naturally. And I was like, well, I see people taking these medications all the time. I talk to people all the time that are taking these medications. At one point, I was caring for people who took those medications, and I would see how they would suffer. So I didn't want that for me. Took the natural route and implemented these changes in my life and my family's life, and it came back full circle. So I decided to share what knowledge I've gained on my journey with others in my community, because these resources aren't always readily available. And when they aren't always affordable. And I get that, you got to exchange and pay and all of that. But some of our people just need a little bit of uplifting and inspiration and motivation. And this is what I'm here to do today. So I took some questions that I had from my inbox over the past week or so. I only took like 5 because I'm only gonna be here for an hour. It's Saturday, hot commodity day, and it's a nice day in PCB. So I'll be on the beach in a minute. But I wanted to go and pay homage to my people and really give back and just share some info. And there were some people who were in my inbox and they really wanted Beautiful Rising. I can't see y'all names on here. That's what I don't like. I don't know who this. Yeah, Beautiful Rising. But yeah, what I was saying. I don't know. I lost my train of thought. Speaking of folks, but we're gonna basically answer some questions that I got in my inbox. And people had some concerns about their health and their children's health and all of that. So maybe you can relate. Maybe you can pass this information to someone else. If you are on this live, we are on Facebook, Twitter, Twitch, YouTube. If you have any questions, feel free to drop them in the chat and I'll correspond with you. Again, I don't know everything, but there's a lot of information that I can share. My specialty is women's wellness, but I've taken care of all types of people from all different races, all different parts of the world, different genders. So yeah, pretty well versed in, a lot of things. But again, if I don't know everything, but I can give you what I got. All right. So you can leave a question in the chat, but I'm going to be on here just for an hour. But I did want to just open up by just talking about like the contributors to disease before I start with these. I think I got like 5. Yeah, I got like 5 that I wrote down from my inbox. And I'm just going to address these because these are common issues that a lot of people tend to have. And maybe, like I said, maybe you could use this information. Maybe you can pass this on to someone else. If not, so be it. All right. So I just wanted to start with the 3 main contributors to disease. Now, I follow Dick Gregory. I love Dick Gregory. I love Dr. Layla Africa. So many inspirations from so many different places. Queen Afu is amazing as well. So much. I just picked bits and pieces of what I need on my journey. But I wanted to share this from Dick Gregory. He talked about the 3 main contributors to disease. And it might surprise you. People be like, oh, people smoke. Oh, they drink. Oh, they don't eat well. Well, yeah, those are co-contributors. The 3 main contributors are 1, lack of movement. People don't exercise. They're on social media all day, or they have sedentary jobs. That was me at one point, working from home, sitting in the chair all day. You get stagnant. If you don't move, you don't have circulation, you don't have blood flow, you don't have healing. Our cells regenerate themselves depending on where it is in the body and what cell it is over a certain amount of time. And the quality of those cells, how good or bad they are, is depending upon what you feed your vessel. So I hear a lot of people say, I put so much emphasis on diet. Diet ain't that important. Can be. It really is, because it's feeding your cells, right? You literally are what you eat. It feeds your cells. And it's not just diet, it's mentally. What are you feeding yourself mentally? Are you telling yourself nice things? Are you talking nice to yourself? And just like physically, what are you facing stress? Are you in a stressful environment? Are you not taking care of yourself? Are you putting yourself last? Those are the little things that add up and make big things that we call dis-ease, because it blocks the flow. So there's dis-ease. There's no ease in the body. And one of those things, again, is lack of movement. Exercise. Every day I'm stretching, I'm walking. Right now I'm on a 3-mile challenge. Every day I'm challenging myself every day in December to get out and walk 3 miles, because I had been doing a lot of work on the computer. What you put in is what you get out. Facts. Zulu butterfly. You speaking facts right now. What you put in is what you get out. And that's just point blank period. A lot of people don't want to hear that, because in this country we have a lot of food addiction. I battled that in my own home with sugar, with mainly sugar, to be honest with you. Sugar is more addictive than cocaine, and it's a real thing, and it's in all of our food. So you got to really be mindful of what you put in your body, because we'll talk about it. Anywho, but lack of movement is one thing. So I challenge you in December to do something as far as moving your body, even if it's 5 minutes of stretching, 5 minutes of yoga, if you into that type of thing, walking, just making sure you have some type of physical movement, because if not, you stagnant. You ain't got no blood circulation going nowhere. You just sitting there. That's how a lot of people develop that are immobile for extended amount of times. Red sores, pressure ulcers, and blood clots. So we want to make sure we're keeping the body mobile and moving. Dehydration. This is huge. If you know me, I always got water on deck. Why? Because the majority of our body is water. If we don't have water, of the components of our organs, of our blood, it's not going to work properly. So you may feel like, oh my God, this is going on. I got this going on, that going on. Something going wrong with my body. And all it is that you need to hydrate yourself. Your body is a fine-tuned machine that's working all day long. But you have to give it what it needs. It needs fuel. And the main source of fuel is water. Water, 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 water. Whether you're eating your water in fruits, vegetables, or if you're drinking H2O, you need to, at least make 64 ounces a day. That's about 8 bottles of water, 6 to 8 bottles of water. And if you got something going on, you need more than that. So making sure you hydrate yourself, because a lot of disorders that we wouldn't even link to dehydration is caused by dehydration. Kidney issues, a lot of kidney stones. I got a question about kidney stones. That comes from severe dehydration. And pregnancy, I know a lot of people have dealt with, moms that I've dealt with in the hospital when I was on the L&D would have low amniotic fluid. That should not be. All you need to do is drink water. You need water. But like, people come up with so many excuses rather than drinking water and hydrating themselves. I'm not going to go there. But you can tell your hydration status by the color of your urine. It needs to be like a light lemonade. Anything darker means that you're probably dehydrated. Anything lighter means that you're good, but you need to probably slow down on the water. We don't want to overdo it and excess it and throw our system off balance. We want to be balanced. So monitoring your urine is the best indicator of what your hydration status is looking like. Arthritis, stiff joints, that comes from dehydration. You ain't got, we have joints and ligaments that require fluid in order for them to move and be lubricated. And if they're not lubricated, guess what? You stiff hearing them cracking bones, don't want to move. People like, how you do them yoga poses? That stuff's so hard. It's not. It's hard when you're not hydrated and when you don't stretch and move. So lack of movement, lack of hydration. The third one is sleep deprivation. Y'all ever know somebody that work third shift, night shift, and they call it the graveyard shift? Why? Because that's where you're headed. And I ain't trying to be ugly. I'm not. I'm serious, because we have a thing called a circadian rhythm, and that's like our sleep-wake cycle. It's on a pattern. I get up at sunrise. I go to bed at sunset because my body is on that rhythm. If I'm up past sunset, I'm likely to want to go grab something to eat or do something to throw me off rhythm. I operate best when I'm up when the sun rises and when the sun sets. I also eat with the sun. When I start my food light and gradually go up as the sun, like right about another hour or so, maybe 2 or 3, I will eat my heaviest meal, because that's when the sun is shining the brightest. Well, in the summertime now, it'll probably be around 1 or 2. So I eat with the sun, I sleep by the sun. Why? Because of circadian rhythm. Certain hormones in your body rejuvenate and replenish themselves while you're resting. If you never rest, then you never have the opportunity to regenerate your cells, replenish yourself fully, and you're working from a deficit. So you definitely need to get proper sleep and staying up all night. Some people are night people, but if you find yourself in a state of depression, anxiety, and dealing with health issues, a lot of people who work night shift end up developing cancer. And that's because I said our cells regenerate, and when they don't get sleep, they're not able to regenerate properly. And cancer is nothing more than a cell that's abnormal. So it's not able to function or regenerate properly because you ain't got no sleep. So get some sleep. Other things that sleep deprivation can cause: mental illness. I talked about depression and anxiety. Poor immune response. Like, your immune system is not what it needs to be because you're not regenerating or replenishing yourself. Endocrine issues. We're going to get into thyroid issues, lupus, autoimmune. All of that is high stress, no rest. All of that is high stress, no rest. Hydrate your body, move. All right, and co-contributors to bad health is diet and smoking. This ain't nothing new. Y'all probably done seen this on a million PSAs, but I said that to just kind of create a segue into these questions that I got. Now, remember, if y'all got questions, please, I'll try to get to all of them, but I got about 5 here. First one I got, it was a mom reached out to me. It was a 16-month-old baby. The baby is vegan, and the baby was losing his hair and had decaying teeth. So a lot of people would contribute when babies, little small babies, because 16-month-old, those are brand new teeth. They shouldn't be decaying. They contribute that to bottle rot, meaning the baby's on a bottle or they're eating too much sugar. That could possibly be a cause. But if the baby's having hair loss as well, that means there's a mineral deficiency. And around 16 months in vegan, I'm assuming that this baby was probably breastfed if the baby's vegan. And if the babies didn't transition off breast milk, then you gotta supplement those nutrients. You can't wean a baby off of breast milk or formula and give them things like soy milk or oat milk. It's not a whole food. It's not enough for their growing body. So you got to replace that. So my suggestion is if the baby is coming off of the bottle or the breast, to implement whole foods. What I started doing early, because I have an 18-month-old that's weaning off the breast now. And so I'm implementing teas. I'm getting her used to teas. I'm getting her taste bud acclimated to tea. So I give her nettles every day. We have nettles together. That's our thing. We create a routine because that's giving her nutrients. Hi. Shout out to my Twitter fam. Genius Gamer. Hi, Genius Gamer. Yeah, so whole foods in the form of, like, I say, like, as raw as you can get them. Herbs, fresh fruits, fresh vegetables, things that are full of water to not constipate baby, but also giving baby nutrients. So we definitely want to incorporate whole foods. We can't just take the baby off of formula and not give them anything to supplement that. And the key indicators, the baby's teeth, that's bone. So that means there's a calcium deficiency probably. Hair falling out, probably an iron deficiency as well. So you can do multivitamins. I'm not a fan of multivitamins. I feel like you can get everything you need from mama being Mother Nature. And I'm a fan of nettles. Nettles are, completely safe for babies, completely safe for pregnant moms. And I give my little one a little bit of nettles tea, not a whole lot, every day, probably like a small, I don't measure. It just, I pour and mix until the ancestors say stop, but just give her just enough. And she's gotten used to it to the point where she's coming to me every day and like, she wants the tea. She know when I got a cup, she's like, so that's something I implemented to keep her healthy. And I think that that's a good thing that you could probably do too, mom. And stay encouraged. And if you feel like tea is not the thing for you, you can look at a multivitamin. If you're going to look at one, I would suggest looking at not like the gummies or anything like that, but something that's more of a tincture or like drops that's easy to ingest. But yeah. All right. Making sure we're keeping the babies nourished. Making sure I wrote down everything for her. And it's just really important. I seen somebody post in the group like, my baby won't eat cucumbers. My baby won't eat fruit. Babies are babies. They're not going to starve themselves. They're going to eat when they get hungry. It may not be their first pick, especially if they've been introduced to sugar early, either in the womb, because if you're eating a lot of sugar, it's in your amniotic fluid. The baby ingests the amniotic fluid and they're used to sugar. And they're not going to want foods that aren't sweet. So you have to change your diet as mommy, especially if you're breastfeeding or carrying a child. And then you have to be example. Kids follow what they see. So if I'm eating fruit every day, my baby is going to want to eat fruit. If I'm drinking teas, what mommy got, they're going to want to drink tea. So you have to be the example. And also, babies don't buy groceries, not the ones that I know. So if you are buying those things and you're allowing those things to occur in your home, a woman could either poison or heal her family. You can, lack of education is big, but, and a lot of people don't want to come out of their regimens of what they think is good and true. And sometimes it's just straight up food addiction. But if you change your eating habits, then babies will too. People be like, how you get your babies to eat that? Because I eat that. They ain't got no choice. Ain't no Cheetos and Doritos in here. And if you eat those things, that's fine. I ain't bashing nobody for their choices. Trust me, I'm not. But when you start having health issues, then it's kind of time to switch some stuff up and reevaluate your eating habits. Greetings, Shireen. I can't even see your name, but you're the only one in the world. Call me Mama Dula. I love you, baby. Kidney stones. We just talked about that. Dehydration. This sister reached out to me and said that it was a pregnant mama, had kidney stones, was being prescribed medication that really didn't make her feel good. And she wanted to try a natural route. Hydration, drink. I'm probably sure most of the world is dehydrated because we don't know what enough water is. I didn't realize how good life could get until I was properly hydrated. Real talk. I didn't even realize how good I could feel or the things that my body can do until I was properly hydrated. But kidney stones is usually a result of severe dehydration in conjunction with too much sugar and probably too much salt too. So mama needs to increase those fluids at least to those 80, I say 84 for her. 64 is a minimum, but 84 ounces a day, at least, because one, it's going to help to push those stones out. Kidney stones, if you ever had one, I've taken care of people who've had kidney stones. I've never had one personally, thankfully, but I've seen grown men buckle and cry because of the pain. They compare it to childbirth. It ain't nothing fun. Drink your water. Eliminate the salt and the sugar from the diet as much as you can. Now, that can be difficult and tricky depending on where you live in the world, because not everybody everywhere in the world has access to great food. I'm in Florida right now, and you would think we would have the best produce. No, complete opposite. I got better produce in Colorado than I got here. Crazy. But eliminating salt and sugar, like syrups, pouring sugar in your grits, cereal, adding sugar to foods, like added sugar, candies, cookies, cakes, pies. I know that this is the season where everybody eats, everybody's together with family, but we really have to rethink those customs, because in the wintertime, I just talked about the circadian rhythm, we have a lot less sunlight. Sunlight helps us to synthesize a lot of chemicals in the brain, one being serotonin and vitamin D. And if these things aren't synthesized, we fall into depression. So people be talking about, oh, we entering the dark months. We kind of are. The days are a little shorter, but if you wake up a little bit earlier, you'll still get that same sun. And that's what I did. I adjusted my sleep schedule so that I could get up with the sun, so that I'm still getting my sunlight and I'm not subjected to depression. So drinking your water, eliminating that sugar and that salt out your diet, breads, pastas, things like that, processed foods. Fresh fruits and vegetables are the way for healing, especially fruits. People say that fruit will drive your blood sugar up. It can. However, fruit is regulated in the body. Fruit sugar is regulated in the body like no other sugar. So it actually bypasses the liver. So the chances of it giving you diabetes is slim to none. So that's another story for another day. But another remedy that I would suggest for kidney stones is lime water. You're already drinking the water, add lime to it, because lime has citrates in it, and it's going to help to break up that stone. So stay hydrated. Get your lime water. Herbs like basil. I think about kidney stones, and I think about inflammation. Turmeric, ginger, implementing these things in your diet. I love you too. Currently doing a juice fast to reprogram my body, my overall quality of life. I am too. I was actually, my body stopped liking cooked food a few days ago. Like, I started some of my favorite foods, and they were healthy foods, and I was trying to eat them, and it just did not taste good, and it didn't make me feel good. And I'm a person who likes to tap into how I feel, and it didn't feel good with my system. So I've been on a fruit fast, fruit and water, for the last 3 days or so, and I feel amazing. So shout out to you for that. It's the time of year where we should be fasting. I got off topic, but I'm talking about the winter months when it's dark and we don't have as much access to the sunlight as we do when it's summer. And then a lot of people don't go outside when it's cold either. So you got sunlight, but they stay in because it's cold, depending on where you live. And that can set you up for depression. That can set you up for sitting up and being immobile and not being active. But we eat a lot during Thanksgiving and Christmas months, and that's the time where we shouldn't be doing it, because our immune system is compromised, because we don't have as much sunlight, we don't have as much outdoor activity, and then you're going to put these foods that usually not that healthy. I don't know about y'all Thanksgiving, but back home in Memphis, Tennessee, baby, beans, greens, potatoes, tomatoes, everything, from the rooter to the tool on the hog. And we put those things on our body, and our body doesn't have the capability to counter that or to repair itself. And if it does, it's going through a great amount of stress to do so. So be mindful of that. Even if you're indulging, try and fast. My sister Shireen says she over here fasting now. My sister over here, Shireen says she fasting now. So you have to reset that system. It's never too late. And then intermittent fasting is a great way to, if you're dealing with a disease, to reset your system, because when you fast, you're not putting anything in it for your body to have to work out or sort through. You're giving your system a time to rest and break. So it's a time where you really, really are in tune with your body. It can be challenging, but it's so worth it. So intermittent fasting is another thing that I recommend for anybody that's trying to reset their system. Thank you for that, sis. Love you. All right. So, I got on here dandelion root too. Dandelion root is a great liver tonic. So those are some herbal things that you can do. And then I wanted to add with kidney stones, anything surrounding the kidneys is usually grounded in fear. So I teach holistic wellness, mind, body, spirit, not just here go a pill or here go a herb or just do this exercise. It takes total wellness to maintain wellness. Now, if I give you a herb, yeah, it's like a little quick fix. It may, be a long-term fix for some time, but if you're continuing to do those same practices that got you in that situation, we'll be right back at square one in no time. So, kidneys, holistically, you want to definitely drink water, incorporate fruits and vegetables. When it comes to spiritually, fear. Kidneys are related to fear. If you're holding any type of fear, it's usually found in the kidneys. Turmeric, yeah, and I hear it's toxic for the body. Turmeric, toxic for the body? I mean, too much of anything is bad, but turmeric is one of the most potent, powerful herbs on this planet. Never heard of being toxic. Never heard of anybody being hurt from turmeric. Heard of people being hurt from Tylenol though. But no, turmeric is an amazing anti-inflammatory. It is. I'm teasing now, but turmeric is medicine. It truly is. So now I've never heard that it was toxic. I've been working with turmeric for a while. I work with turmeric in several different populations, and I've never had anyone to have any issues from it personally. Now, if someone told you it was toxic, maybe you want to ask their personal experience and get some insight from them. But me personally, in my journey, I've never, ever heard turmeric to be toxic. Now, you definitely want to make sure you're getting quality herbs. And if you're going to use the turmeric root, make sure you're getting organic. Best as possible. Some of that stuff still ain't organic when they say it, but never heard it being toxic. My experience. Maybe the person that, or the source that you heard that from, they'll be able to give you some insight from their perspective, but I've never heard it being toxic. So, fear in the kidneys. If you're fearing something, recite some affirmations. Nothing to fear but fear itself. For every issue, there's a solution. So work on speaking affirmations, working on parts of you to face those fears. Work on diving into things that you're fearful of that you might not even realize that you're afraid of, especially if you're pregnant, because that baby is feeling everything that you're feeling. So kidney stones, hydration, lemon water, herbs like turmeric, basil, dandelion root to help break that thing down, and then ridding the body of fear. Affirmations. I am not fearful. I am capable. Whatever floats your boat, speak that to yourself every day. My husband just started working with some new affirmations, and he was like, they telling me stuff I already know. I said, your conscious mind knows that, but does your subconscious mind knows that? And he was like, aha. So speak to yourself. Talk to yourself nice every day. Every day. Because if you don't tell yourself who you are, the world will. All right. So that's what I got about kidney stones. Moving on. Autoimmune disorders. Let me see. So I had a sister to write in that she has been battling lupus, having iron issues, and it's affecting her joints. All right. So lupus, if anybody's not familiar, is several different types of lupus, but it's basically founded in the same thing: high stress, bad diet, dehydration. And it really triggers the things like the thyroid gland. And the thyroid gland is responsible for, remember I said those cells are remade periodically. The thyroid gland is responsible for that metabolism of those cells. So when that's messed up, you're talking about heart issues, brain issues, organ issues, or it can go the other way and be musculoskeletal and give you aches and pains in your joints. That is all inflammation. And if your body is doing those types of things, that is something you're putting in it. Lupus, MS, rheumatoid arthritis, Crohn's disease, that is all pointing to that you're putting something in your body that your body is seeing as foreign and toxic. And that is, and we can even listen to the term autoimmune. Immune is giving a response, an immune response. The body is doing what it's supposed to do. It's trying to get that toxin out the best it can. But if you don't know what that toxin is and you're constantly introducing that to your body, you're going to have these repeat episodes that likely is going to get progressively worse. Prednisone is probably one of the worst things you can give someone with lupus because it shuts down their immune system. Your immune system is talking to you. It's screaming to you when you start to have a butterfly rash, when you get the inflammation, when you get the pains. That is your body saying something ain't right here. You don't want to shut that down with prednisone because all it's going to do is just quiet that response. It's not going to heal anything. So people feel like they're healed or they're cured because they don't have symptoms. But as soon as they come off their prednisone, it comes back with a vengeance. Or they have whack side effects from prednisone. Prednisone is known to cause high blood sugar. It's going to give you diabetes. So why am I going to trade off lupus for diabetes? Make it make sense. Matter of fact, don't. Yeah, it's all inflammation and it stems from food, mostly food. A lot of us eat foods that contain additives and chemicals, and people don't want to hear this because they love their food. And I ain't bashing you. I promise you I'm not, but I'm just telling you the truth. Or they will say in Memphis, what God love. A lot of our foods, and if you Google some of those ingredients that you can't pronounce, it'll tell you that it's known to make people sick, that it's carcinogens or known cancer-causing agents, or can cause GI irritability. And if you're eating those same foods every day, then maybe we need to reevaluate that. Another thing that's overlooked is products that we're putting on our body, not just in our body, like hair care products. I see people with the edge control and the edges. These right here, that's a direct center to your wound. So if you're putting chemicals that are toxic, EDTA, TBQH, all of them, red number 5, blue number 4, all of those things are artificial, created in a lab, and our bodies don't recognize that as being natural, so it has an unnatural response to those things. So things you put on your body and in your body, you'll find that if you use a hair care product, I know I did, I found an edge controller because I like my edges laid sometimes too, but I had to go to okra and flaxseed because some of the stuff that I was getting rid of out of my diet, because I read labels, they put in the hair care products. And I was like, I don't want that. And usually they're preservatives. So I ended up going all natural with my hair care products and my body products. So if you're putting anything on your hair, your body, your skin, it's being absorbed systemically. So reevaluate. Go in your medicine cabinet and look at the stuff, or your shower, look at your shower gel, look at all types of things that you're using and see what chemicals they have in them. And that could very well be a contributor. It could be a small fix that could be causing a whole big old problem. Another thing is the food. Look at the foods. High salt, high sugar, high fat, no exercise. Recipe for disaster. Medications can also cause this as well because they don't hide anything from you. If you are on a medication, they usually come with pamphlets and leaflets, and they'll tell you exactly what that medication is comprised of. So if they have things in them like red number 5, TBHQ, EDTA, then you might want to talk about alternatives with your provider, or even talk to a herbalist about good herbs that you could substitute in place of that medicine, because they can sometimes make you sick. And I'm gonna pick on prednisone just for a minute here again, because I've seen a lot of people get like a lot of weight gain with prednisone. Crazy blood sugars end up with type 2 diabetes when they were never diabetic and on insulin because they're on the prednisone. It messes your veins up. It's a steroid. So usually these people with lupus, they're having to go to the doctor and get like blood drawn, blood tests. They stick you so much because your veins are like, it really destroys the body. Prednisone does, and it affects the heart, something serious. So be mindful of that. And just listen to our bodies with autoimmune disorders. Autoimmune disorders is something that you can completely, people always say, you can't cure that, you can't. Well, no, if you are constantly putting the same thing in your body, but if you are reevaluating what you put in your body, and I've seen people like do complete 180s with their diagnosis with lupus by just changing their diet. A lot of the white sugars, white flour, white rice, things like that, it wreaks havoc. And then they give you medicines that really don't help. I'll be honest with you. The side effects, it don't balance out what you're dealing with. So got a question real quick. I have a question about during cycles. Are blood clots normal, like excessive clots? Absolutely, positively not. That's hemorrhaging. When you get a cycle, I'm gonna get real personal here. I've been breastfeeding on a journey now about 18 months. And while you're breastfeeding exclusively, you usually don't have a period because it tells the body that, hey, I got an active baby that I'm breastfeeding. I don't need no more right now. I got to graze this one. So after we started weaning, my cycle returned, and I was amazed because during this last pregnancy, I've adhered to listening to my body and what is right and true for me. And my cycle was so light, no PMS, no cramping, and the bleeding was very minimal. Had a 4-day cycle. So if you're having excessive clots, mind, body, and soul, the period is a time of detox, mentally, physically, and spiritually. So if you're having heavy periods, getting rid of meats, especially around the time where you're cycling. Track your cycle so you know when you're starting a cycle. If you just can't let go of that stuff, then you need to at least go light when it's time for your cycle, because your body is detoxing through this cycle. The blood is getting rid of the toxins and everything that you did not need, did not use. That's your body's way of cleaning up. You don't want to give your body extra work during your cycle. First thing people want to do when they get their period is eat sweets. That's going to make you bleed heavier or have cramps. Eat light, eat fruits, vegetables, water, stay hydrated so that you feel your best and you give your body what it needs to do, what it needs to do. If you're having excess clots, let me get back on topic. If you're having excess clots, you need to do some detoxing. One thing you can do is yoni steaming. Another thing is motherwort. Motherwort is an amazing herb that you can steam with or drink a tea during your cycle, before your cycle. Yoni steaming, I would highly recommend. A lot of women have PCOS, polycystic ovarian syndrome, and that is because us as women have been operating in masculine energy for way too long. The time is over. But when we operate in masculine energy, we think it doesn't affect us. Oh, we out here independent. We don't need no man. We work at 8 jobs. I don't need you, boo. I got my roles. Well, you are now doing the job of a man and a woman. And now you got man and woman hormones. And if you're out of balance, you're having too much testosterone, and that can cause heavy periods. And that testosterone is also produced with stress. So a high stress lifestyle can also produce heavy periods. If you are wanting specific insight, you can feel free to inbox me. We can chat it up, sis. I have tea blends specifically for that, or you can make your own. You don't have to wait on me and depend on me and no herbs. You can heal yourself. But hit me up in my inbox if you want to talk specifically about periods, because that can be a number of different things. But also talking to your yoni. I do womb meditations. Try to do it every day, if not every other day, talking to my womb. That's my powerhouse. That's my divine feminine energy. So I talk to her nice. She remembers things, good, bad, and indifferent. I don't want that stuff to be in there that I don't want. So I got to clear out that old memory of stuff that I don't want. So I talk to her and I hold my hands there and I breathe and give her oxygen and I love you, yoni of mine, and talk to her and all that good stuff. But let's chat outside of this if you're wanting specifics. But hydration, lowering your stress, watching what you eat, steaming, and motherwort is a good herb to kind of get you over, because what you're doing is hemorrhaging, and what ends up happening is you end up, if you're not on no herbal therapy, like taking nettles or got an iron supplement, you end up iron deficient. So a lot of Black women are iron deficient and anemic because they have heavy periods and they're not restoring those things with their foods. A lot of our foods have very minimal nutrients, especially if it's cooked. So that's what I gotta say about that. All right. Everything revolves around food. I know, y'all. It was hard for me too. I come from Memphis, Tennessee, the land of the best freaking food in the world. And I was able to let go of fried chicken. It's mind over matter. That food, you don't let the food eat you, you're gonna eat the food. Because if it's making you sick, it's eating you. So who's in control here? And I do know it's an addiction, and that's okay, but we can get through it together. Each one teach one. And just like addictions, you have relapses. You set yourself back, but then you start to realize what makes you feel good and what doesn't. So we don't keep going back to those things and loving those things that don't love us back. And that's all I got to say about that, because people get real in their feelings about food, babe. I done lost some people in my life giving unsolicited advice. I'll be honest with you. Like, why are you eating it? But it don't, people are in different spaces in their journey, and I've learned not to judge people where they are, but when they want my assistance, when they ask for my assistance, to assist. But we need to get hold of that. Like, if we couldn't taste food, if we didn't have any taste buds, would we really be eating the stuff that we eat? Or would we eat to live? All right. All right. So what I have next? Oh, I did want to add some stuff about the autoimmune disorders. I did put remedies down here too. One thing about the autoimmune disorders, your body is attacking itself because of what is in it. Like what's in your bloodstream, what's on your body, what's in your body is foreign, so it starts to attack itself. Take your power back. Affirmations. Take control of your body. Your body doesn't control you. You control your body. So taking your power back, affirmations, sitting with yourself, talking to yourself, talking with yourself. Whatever floats your boat, however, whatever that looks like for you. But you need to take your power back because it's been taken from the food, by the food. Eliminate toxins from your body. We talked about that. Blood cleansing foods and herbs. I talked about nettles. Oregano is a great blood cleanser. If you get an oregano tincture or drinking the herb as a tea, wonderful, wonderful blood cleanser. Also great for herpes. I've seen many of people turn around their diagnosis of something that's incurable, but I ain't gonna go there. And then, of course, hydration. Everything revolves around food and water. And if you didn't know, you could go longer without food than you can water. So why are we not hydrated again? All right, back to it. Anti-inflammatory herbs, ginger, turmeric. Those are like powerhouses, especially during these months. In my nettles, I add a little bit of fresh ginger because during these months, susceptible to inflammation. It's cold and flu season. And I want to make sure I'm on point. Ginger, turmeric. Powerhouses. My niece, I love you, Kiana, called me and she was like, girl, I got this sore throat. I'm feeling like crap. I don't feel good. I said, baby, how long you been feeling like that? For about 2 days. I said, go get you a spoon full of ginger, either minced or fresh. Add some honey on it if you want. If not, no, take it down. And I said, do that about twice a day. She called me the next day, girl, that stuff gone. I feel good. She was all in the group chat, the family group chat. Girl, then they gave me some stuff that worked. I just gave you what nature gave us. I can't take credit for that, sis. I turned you on the game, but nature done been here curing people, doing this thing since way before we was here. So a lot of people don't trust in it, and that's okay. Everybody's journey different, but yeah. Another thing that can help, I talked about diet with autoimmune disorders, lupus, MS, RA, rheumatoid arthritis, foods that are high in omega-3s, avocados, good fats, walnuts, thinking about, I'm trying to do it off the top of my head, almonds. If you eat fish, that's another source of omega-3s. But I like to do like the fish sometimes like have so many different byproducts in it right now. So like real food, avocado, raw. You don't have to cook and deep fry everything. Just eat it in its natural state. The more we prepare it, the less nutrients we receive. And that's why people tend to go with raw vegan too, or raw diets for a while to reset their system because they want all of their nutrients. And if you're cooking food, the more you cook it, the more you process it, the less of what you get from that nutrient. People want to make it look like everything, turn mushroom into a steak. Yeah, and it's okay to get you over the hump, but we're going to have to enjoy that mushroom as a mushroom at some point and stop substituting it for meat. I mean, it is a transition, but eating whole foods in their rare form and not, covering them in salt to mask their taste and things like that, but just really ingesting our nutrients whole. If you're not a big fruit or vegetable person, gonna make your journey a little difficult, but incorporate herbs. You can drink herbs, you can soak your feet in herbs, you can even bathe in them. You'll get the same effect. It's absorbed systemically. All right. I got a question from a pregnant mom. Let me see where we at on time. She said she had bleeding in the second trimester after being intimate with her partner. Is this normal? Second trimester bleeding can definitely be normal because you got a growing baby that's growing really rapidly, and it's probably pressure on the cervix. So sometimes intercourse can be rough or irritate the cervix or aggravate the cervix. Just as long as that blood isn't it's not like saturating a pad or your underwear. If it's like spotting, that's completely normal. And it shouldn't be like bright red blood. Any bright red blood during pregnancy for a prolonged period of time and you're not in labor is alarming. That could mean that you're having placenta abrupto, which is a medical emergency. That means that your placenta has detached. And that bleeding is come because your placenta has detached from the uterus and the baby is now in there with no oxygen supply. So if you're bleeding and it's heavy, you definitely need to see whoever's keeping you while you're pregnant, like your midwife, hopefully, look at me throwing shade, or your doctor, whoever you got, your OB. But it's normal if it's just like light spotting that shouldn't last no more than a day. And it should really go away pretty quickly. But if it's progressively getting worse, or you're passing clots and you're in that second trimester, then you definitely want to reach out to whoever you are seeing for prenatal care, because it's not normal to be bleeding heavy. But light spotting is, you got a lot of capillaries and veins around the cervix area, and then you got a baby head that's, well, whole baby at that point, not just the head, but the whole baby. It's getting bigger and it's weighing down and pressing down on your cervix, and that can cause it. And then sex can aggravate that, but just as long as it's not prolonged bleeding. And then if you're bleeding constantly after sex, or you're not quite in that second trimester yet, it could be an indicator of a STI, sexually transmitted infection. And that's something that's typically taken care of very easily. I don't recommend antibiotics for any pregnant mother, but you can do things like probiotics. Works just as well. And then hydrating yourself, eliminating things like yeast and sugar. I'm gonna get back to that with every condition. And STI, coconut oil. A lot of yeast infections sometimes occur with pregnancy. If that's occurring, you definitely need to check out the breads and the pastas that you're eating, yeasty foods. And then coconut oil, using coconut oil down there in the vaginal area. Coconut oil is an amazing, organic, unrefined coconut oil is an amazing antibacterial. Eating some of my homemade guacamole with arugula as you speak. Send me a bowl. Give me some of that. I love some good guac. I'm over here munching on some cantaloupe and some guava. That's what I got today. That's all they had at the market. And the other stuff, subpar. Not fit for my temple. Teasing. All right, so that's that about that question. Second trimester intimacy, bleeding after intimacy, just making sure that you are not bleeding any heavier than when it starts, and it's just enough to where it's not like a period. It's just like spotting. All right. So next is, I got somebody with a vaginal discharge. So she had a vaginal white discharge. She took antibiotics and was giving diflucan. So if you don't know what diflucan is, it's used for yeast infection, just like the little red pill they give you if you take antibiotics, because antibiotics cause yeast infection. If something is causing a yeast infection in your body, then it means it probably ain't working to do what it needs to do. So if you are still having vaginal discharge after your antibiotic, a couple of things could have happened, because sometimes, well, most times, antibiotics wipe out the bacteria that causes yeast infection, but it also wipes out the good bacteria. There's good and bad bacteria in your body, okay? And when there's an overgrowth of yeast, that usually means your diet is out of whack or something is off balance. If you had a round of antibiotics and a diflucan and it did not work, likely a couple things happened. You didn't have a yeast infection, or you didn't finish your antibiotics. Sometimes white discharge can be other things, not just a yeast infection. Usually yeast infection involves itching as well, and like a cottage cheese looking discharge. So you want to make sure that you are actually being treated for the proper thing, first of all. Second thing is, you can definitely try coconut oil. If you don't see it going away, you can take coconut oil. Your hands are clean. You can get some coconut oil, wipe it down there, or you can either take whatever floats your boat. I just feel like your hand is suffice. It's your body. Wash your hands, put coconut oil down there. Okay, it's really, really great for yeast. Also, moms and babies, like a breastfeeding mom gets like yeast on her breast because you eat too many yeasty foods. It can get the baby thrush. Coconut oil works wonderfully for that. Something so simple and right at your market. Yoni steaming. So if there's anything going on, getting you a yoni steaming, working with an herbalist if you're not familiar with herbs, to get you I just feel like yoni steam herbs are never one size fits all. You do have your basic herbs, but depending on if something's going on like this, you need specialized herbs. And talk to your herbalist if you're not familiar, and see what herbs you can use to steam. And if I like to use herbs that you can steam and drink, you just kind of getting them both ways, right? So yoni steaming, coconut oil, hydration, cotton panties or none. You can free ball that thing. But the Cootie has to breathe, y'all. If you put on all them underwear and all them layers of clothes, just imagine if you put that on your nose. The vagina is an orifice, it's an opening, and if it has no way to have circulation or ventilation, then it's going to, like, all that stuff is going to just kind of back up. And that's when we have an overgrowth of yeast, because there's no fresh air getting there. People are like, oh, she nasty, she don't wear panties. Well, guess what? She ain't got no, don't do that. Using organic soaps and hygiene products. Making sure you're not putting the Vicky's Secret down there, the Caress, and I know they smell so good, but they contain artificial things that the body just don't recognize, and it rejects it, or, you know, throws us out of balance. Yeast infections, STIs, UTIs, which is a urinary tract infection. Be mindful. Your body is talking to you, telling you everything you need to know. Are you listening? All right, so that's what I got about the white vaginal discharge. There could be a number of things, but you first need to make sure that you're being treated for the right thing, because a white discharge could be a couple of things. Actually, right before your period starts, you usually see a white discharge because there's mucus in the cervix to help to trap any sperm that comes in to help to get you pregnant, if that's what you're looking for. So if you got a discharge, it can sometimes just be normal, but if it's prolonged, accompanied by odor or itching, then guess what? We got an issue there. There's an imbalance, and if it's itching, then it's likely a yeast infection. And if you didn't finish those antibiotics, go for the coconut oil before you go for another round of antibiotics, because, like I said, antibiotics can be very it can be a bit much, because it wipes out the good and the bad bacteria. So they ain't always the best. Did I cover BV preventatives and treatments? I did not, but I will. So BV, also known as bacterial vaginosis, that is the stanky cootie syndrome. I'm gonna be real frank with y'all right now, and it happens. I used to be a victim of this when I didn't know how to take care of myself properly as a younger woman. And I was thinking that it was just normal. I would go to the doctor, get a pill, get a flagyl. No. And it was something so simple. It was dairy. I had a dairy intolerance. And instead of me throwing up or getting physically ill, my woman parts got upset. And that was a recurring thing. And when I let dairy go, didn't have any of those issues. Another thing, like I talked about, it goes hand in hand with the yeast infections, bacterial vaginosis. But one added thing with the yeast infection is sexual intercourse. Let me tell y'all something. If you with a man and y'all are having unprotected intercourse, and his diet is not in alignment with yours, it can throw your pH off and cause bacterial vaginosis. If you are wearing clothes, me personally, I love yoga, but cannot wear them cute yoga pants because it does not, my body don't like it. They're too tight, they're too restrictive, and it doesn't allow proper ventilation. That can set you up for BV. So making sure you have proper ventilation to the vagina, making sure that you are hydrated, and checking your diet. Lots of sugar, lots of yeasty foods, lots of pastas and breads, and also your sexual hygiene, making sure that you're mating with a partner that is in alignment with your diet. If you're not, like my husband used to eat dairy, and we had issues because I didn't eat dairy, so he had to stop eating dairy, and that's what we had to do because I care about my wellness. He loves his wife, so we had to meet each other in the meeting. All right, so that's what I got. Any other questions about BV preventatives? Hydration, keeping the vagina ventilated. It's the same thing. I have this Yoni 101. If you inbox me, I'll send it to you. Yoni 101, which teaches you how to take care of the womb space and prevent things like that in depth. It talks about keeping cell phones and radiation away from the vagina. It talks about different foods. It talks about spiritual health. So I would say, just as a broad overview, making sure you're eating things that are in alignment with your body. Like, try eliminating one thing at a time. If somebody tells you, like, that pasta may not be good, try cutting back on the pasta and see if that changes anything. Try cutting back on the sugar and see if it changes anything. But usually it's diet-based or either sex-based. Diet-based or sex-based or lifestyle-based. Like, you're not properly ventilating the vagina, or you're using products that's not in alignment with the vagina. Or toilet paper. Making sure you're using quality toilet paper. I don't use toilet paper no more. I use a Perry bottle, because the toilet paper can sometimes have dyes and chemicals in them that can irritate your yoni. So looking at your toilet paper, looking at your food, looking at your feminine hygiene products, even pads. I'm gonna give you that. Message me and just inbox me so I can send you that, and I'll get you added to my Sacred Womb Healing Retreats group, because we're going to be doing some amazing things in there shortly. And we also have a womb wellness course. It's $10. $10 a full course. It's gonna teach you how to love on your womb, teach you how to love on yourself, because we need it. And if you're interested in that, let me know and I'll get you the link. But it's a womb wellness course. It's an entire course, and it involves like a workbook, and it gives you like step-by-step meditations and things you can do to kind of get yourself in alignment. It teaches you how to yoni one-on-one, like what a menstrual period is, and what, like, ovulation, what does that mean? Like, we hear these words, but who actually sits down and talks to us about this stuff? I saw a sister talking about she gave her daughter a pink tent ceremony when she was 10, preparing her for her period. And when she got her period, she wasn't scared. She was like, okay, I know what to expect. And she was excited. We can rewrite our stories when we become educated. So that's the purpose of that course. It's just to teach us stuff that I know I didn't get when I was younger. So yeah, and Shireen was part of the course too. She took the womb wellness course. So yeah, y'all 55 minutes. Let me get the moving, y'all. Y'all got questions? Come on through. I think that's it. Oh my goodness, I got all of them. Oh, thyroid disorders. No, I didn't. Somebody wrote in and said that she's been having thyroid issues, and the meds that they're giving her make her sick. She don't like taking them. Again, it's an autoimmune disorder. When is the course happening? The course been going on since summer. I got to do better with advertising. A lot of my people come to me through word of mouth. I treat people well, so they come through word of mouth. So I've gotten kind of spoiled on marketing and sending stuff out, but I'm going to get better with that. But it's already occurring. It's already happening. If you're interested, inbox me. I will get you added to the group. And if you want to join the course, then go ahead. It's $10. I ain't even no value meal nowadays, $10. Yeah, thyroid issues either come in the form of hyperthyroidism or hypothyroidism. Hyperthyroidism means that your thyroid is just overactive. You have symptoms like your hair falling out, rapid heartbeat, you cannot put on weight. Sometimes people have bulging eyes. They call it Graves' disease because they scare people and think that it's really something that's going to kill them. No, it's usually a diet thing. High stress, bad diet. And so some things that I would recommend for thyroid is evaluating your diet. I can say that till I turn blue in the face. Yep, the yoni course. Yep, my bad, y'all. I get like squirrel brain. I don't do this all the time. I be happy to see y'all though, but I don't do this all the time. I got squirrel brain when y'all be talking to me, want to answer y'all questions and be in the middle of a sentence. So forgive me if I'm a little scattered. I'm excited. The yoni course is up and going. Yep. The blooming womb wellness course is what it's called. Yep. So some things with hyperthyroidism, again, like I said, that like you have rapid heart rate, you have a super high metabolism where you can't keep on weight, you are hot all the time. Diet comes from diet, and it comes from high stress, and something's throwing us off, an imbalance, and it's not something that you have to deal with or take lifetime replacements or even get surgery for. Some people even have to have their thyroid removed and then get thyroid replacements for the rest of their life. Make it make sense. Don't. Some herbs, bugleweed, lemon balm, also known as Melissa, B vitamins. I like to use B vitamins from herbs. I don't like, a lot of people get B vitamins from meat. I'm not a meat eater. So B vitamins from herbs like nettles, oat straw. What's another one of my favorites? Burdock root. Bugleweed, I mentioned those. Bugleweed is specific for hyperthyroidism though. So those are some remedies, and you can maybe, instead of that pill that you're taking, you can try incorporating this into your diet. And if you just really, dead set on taking medicine, let your doctor know that it's giving you bad side effects. And if they're telling you to just deal with it, then you need to start to look at some other options, sis. Nobody should have to deal with a remedy for their entire lives that's making them sick or make them feel ill. That's your body saying that something ain't right. So maybe you want to try some of these herbal therapies. All right, talk to your herbalist. Hypothyroidism, on the flip side, is when the thyroid activity is low. Hypo is low. And that means that you are low on your iodine reserves. And a lot of people, with hyperthyroidism too. Let me jump back on that real quick. Stay away from shellfish because they contain high iodine. Iodine is going to trigger your thyroid to continue the levels to go up. So stay away from shellfish and iodine containing foods. Opposite with hypothyroidism, you won't. Oh, gratitude, baby. I'm a vessel. I give thanks. With hypothyroidism, low thyroid, you want to restore your iodine levels, which means that I won't recommend shellfish, but I will recommend things like sea vegetables, kelp, seaweed, sea moss, things like that. They're really good with restoring the iodine levels in a natural way. And then you let me see. I'm over here like brainstorming. I thought I wrote enough notes down. Sugar. Hypothyroidism is sometimes caused by sugar as well. So I can't say that enough. Diet. But with the hypo and hyperthyroidism, both can utilize things that are like high in B vitamins, like nettles, oat straw, burdock root. And then with hyperthyroidism, with the exception of bugleweed for hyperthyroidism, and then you want to stay away from the shellfish. Let me see what else I got on here for y'all. Anybody else got anything? Let me see. Yep, that's what I got. So thanks so much for this information. This session, definitely sharing with my sisters. Please do. Anything I share with y'all, feel free to share because it's divine knowledge. Knowledge is infinite and powerful and true, and it don't belong to none of us. All right, so we share one. We shared it. It's each one teach one. Somebody shared this with me. Nature, when a lot of these things I learned in my personal experience, because again, I had to heal my own body. I was overweight, I was sick in my body, heavy periods, depression, anxiety, you name it, feminine issues, and I was able to really correct what I was doing by getting my mind right and getting my diet right, and then all the other stuff started to follow. So just know that anything I share, feel free to share it. Knowledge is power when it is implemented in your life. Don't be around here getting all this knowledge and just holding it. Share it. Even if you just, share it in common conversation or you implement it in your own life, applied knowledge is power. So with that being said, I enjoyed y'all. This was nice. Maybe I have a follow-up depending on like the response from this. I really like just sharing knowledge and wealth. So reach out to me with any questions that you have, and maybe we can follow up with another segment if you got one. If you got family members that maybe have issues that they got questions about and they're not really trusting them MDs like that, I know a lot of stuff. I don't know everything, but if I don't, I can probably get you to somebody who do or point you in the right direction. So we need each other. We really do. So I did want to close with saying that I am offering face mapping. This is something that is very new for me. Implement facts. You got to implement that knowledge. I know professional knowledge hoarders. They be in my inbox every other week, and then they come back with the same old thing. I'm like, girl, didn't I just tell? Okay, all right, but I'm not getting on nobody nothing. I'm not bashing anybody. I promise you. I'm just I'm being funny. But everybody has their own pace and their own journey. I'm one to assist as best as I can, but you have to help yourself too. Having the knowledge, one thing. Applying the knowledge is the actual power. All right. So again, I'm offering face reading, something that I really hesitated on. But it's being called for me to do. So it's also called face mapping. If you've not heard of it, it's like an ancient Chinese or Ayurvedic type therapy. What you do is you look at the face. Different parts of the face corresponds to your physical organs, as above, so below. So it's like the face is a folding chair. So you can look at the face and tell like different parts of where a person is having dysfunctions or dis-ease. Like at the chin, if a woman has chin hairs or discoloration or bumps on her chin, it's usually an indicator that she's having some issues with her feminine health or her uterus. This is the womb space. Here. All right. The heart. That's my new. I felt that thing. It was my new nose ring. The heart. Brows in here, and then like the kidneys under here. If you got dark circles under here, your kidneys overwork. You need hydration. You need to flush them kidneys out. You maybe need a herb that's good with the kidneys. My little nose ring. I pay good money for this. Come here. So yeah, I use a picture of you. We could do video, or you submit a picture. If the picture you submitted suffice, we do a reading, and then we give recommendations and herbal recommendations, or like guidance as to what you could do to possibly counter those things. That's on the website. If you're not familiar, my website is www.bloominglotusbirthingservices.com. Check out what we do, what I do. If I'm just popped up on your feed, you're like, who the hell is this lady? I do quite a bit. So yeah, I specialize in birth work, but I help all people that I can. I assist. You help yourself. I assist you. And I can provide some sound advice in most cases. But again, I don't know everything. I don't claim to. Still very actively learning on my journey and becoming all that I am. But there's a lot that I can share. I've seen a lot. I've done a lot in my very short time of being here on this planet. But I came to do the work, and this is part of it. So I thank y'all so much for sharing y'all Saturday with me. This is really profound. Saturdays are hot commodities for family. So I appreciate it. That's an investment. Be proud of yourself. Love on yourself. Be good to yourself. That way you can be good to everybody else. All right. Peace and be well, Soul Tribe. I love y'all to life.